with that being said, I mean, again, you're still an associate, right?
Correct. I'm still an associate.
Okay. So
Yeah,
what's your plan now? You briefly touched on that, but what's your plan for building from, so you started out from ground zero and you went from 0 to 3 months and then all of a sudden you're booked out.
sure.
Now, what's your plan from that point and going, let's call it the next year?
Sure. That's a great question. So my practice, works in interesting ways where my grandfather had a patient come into his office who was a rabbi, actually two rabbis, and he helped them relatively quickly with very serious health conditions. And in the Orthodox Jewish communities, it's very connected, very word of mouth is quite like no other. And once the rabbis told many of the people in the community, my grandfather practice completely exploded in like the 60s.
Sure.
So from there, our bread and butter is really the Jewish communities all throughout Long Island, New Jersey, Manhattan, upstate New York. And all these communities all know, Forster healthcare in that world. So in the Brooklyn office in Williamsburg, there is a very religious community in one of our office locations. And so that's booked out. However, my father was practicing in the city, and he practiced for a long time in Manhattan, but he stopped practicing there about 2 years ago. And the reason why is because he lives in Long Island. The commute from Long Island to the city is could be a little bit difficult, especially if you're not taking the railroad. And but I have a dream of practicing in the city. So because it lost this momentum after 2 years, I'm kind of starting the Manhattan practice a little bit from the ground up again. So what's interesting is I'm living this alter life where I go into this Brooklyn office and I see the entire community completely booked out. And I go to the Manhattan office, and although I'm doing very well, I'm not to the level of the Williamsburg office. So what my goal is over the next 2 to 3 years is make the Manhattan office as busy running as the Williamsburg office. That's my own personal project right now. So that's part of it. And also, I love treating that community. The people there are wonderful. However, I don't want to pigeonhole myself to just one patient population. And the best way to open myself up to all different people on this earth, I mean, there's no better place than the melting pot of New York City. And one thing I know that for me to do that is to have it in the city. So it's one of those things where I'm trying to touch in different populations, trying to grow the Manhattan office the way my father had it before he stopped practicing there about 2 years ago, and building that up. And so right now I'm working up 2 days a week in Manhattan and 4 days a week in Williamsburg, and eventually over time take on the Manhattan office and maybe work 4 or 5 days a week in Manhattan, 2 days, 1 to 2 days in Williamsburg. So that is a little bit uphill battle, but I enjoy that process. And if I, speaking on coasting, if I really want to coast, I would just work 6 days in that Williamsburg office, and I would be, completely successful financially. But maybe I won't feel fulfilled on what I'm trying to create of myself and what I'm trying to create in the city office.
Sure, absolutely. Now, what's your approach to building up the Manhattan office?
Yes. So for starters, because there's too many patients in the Williamsburg office, I'm spending 30 minutes with a patient. I mean, some chiropractors would think that's like a glorious amount of minutes. Some are only like 5, 10, or 15 minutes. However, for the Manhattan office, I actually spend about an hour with each patient.
Mhm.
And the part of the reason I do it is we all know as chiropractors that if we can make our patients feel better and we're as effective as possible, that will lead to a referral because everyone walking on this earth is dealing with some kind of health ache of some sort. It could be a stiff neck all the way to a disease of any condition, right? So it's one of those things that with each patient in the Manhattan office, I am putting my heart and soul. I put my heart and soul in every patient, but I spend that extra 20, 30 minutes with a patient in the city office to really make sure that the reason they came in within 2, 3, 4 visits, we reach the success. And I put the results first. I let the results speak for itself. And it's working. In the sense that I have a patient coming in today who's flying from another state into New York City to see me.
That's great.
And it's just from word of mouth. So as far as that, the other time I spend a lot of time on LinkedIn. So I have about 6,000 followers right now on LinkedIn. And about 1,000 of the 6,000 are from New York City alone. But what's interesting is of the 6,000, 99% of them are doctors. And a lot of my referrals are doctors sending patients to me. So the concept is, they're always trying to say, how are you marketing to patients? I don't really market to patients. I let my results speak for itself. But I really market to other doctors and try to create that relationship business. So doctors could say, I don't really know how to treat a newborn baby and they're, having a difficult time breastfeeding. I know Dr. Cal Forster can really help with that, or with, a torticollis of a baby. I can't see this baby's neck turn only to the right for a day longer. I got to send this baby to Dr. Forster, right? And that's kind of where my approach is on building it in that standpoint.
So again, you're really focused on relationships. So not only are you building good relationships with your patients, but you're building really good relationships with a multitude of other doctors.
Exactly. And not just chiropractors alone. I just had a lunch the other day with a medical doctor in the city who does alternative medicine, but through painkillers. And I was showing him a little bit of the connections in the body that, he never even heard of, that almost like scared him because it's like, wow, it's never been taught. And he sent me 2 patients this week.
Wonderful. Now, let me ask you this. Do you send reports? What's your communication process with these other doctors, and how do you get audience with them?
Absolutely, absolutely. So one thing I express thoroughly is when I get a referral from another doctor, they don't become my patient. It becomes our patient. And we learned that really well. I think it was called IPC, interprofessional collaborations, is what we learned in school. And everything I do or talk about, I let the patient know I'm going to express it to the referred doctor who referred me. And I want you to get in contact with him or her or whoever the doctor may be. So it's one of those things that it becomes our patient. And at the end of the day, one thing I explain to patients is, you're not mine, you're not the other doctors. The greatest doctor in the room is your own body. So whatever helps you and your family, we're all here as a resource. So that's kind of how I do it. And then I always try to keep the other doctor I'm speaking to or healthcare practitioner up to date on everything and anything, and vice versa. Like one thing is I love exercising. I love working out. I'm very into calisthenics. But one thing is I don't do rehabilitation exercises in my office. That's just not where my passion is as a doctor. However, with that being said, that's where I give referrals back, for example. So if someone has recovering from a torn rotator cuff after surgery, I can help in certain components. However, I'm not going to teach them how to do an exercise routine to recover their rotator cuff surgery. So that's where I'll refer to another doctor, and that I think will fit the role the best to their ability.
Excellent. That's great. Okay, good. So you're constantly, so it's not like you're just cold calling medical doctors. When you see a patient, you want to know who their doctor is.
Exactly.
And then you'll reach out to that doctor to explain to them what kind of progress your patient that you share is making.
Yes, and one just to give like a little clinical pearl for patients, for doctors. So I do a lot of blood lab tests on a lot of patients, and I write my own blood scripts. And when I get the result back, you'll see on the top header, it always says the doctors who they either I got blood labs sent to me or I'm getting referred out to get a blood lab test done. A great way is to actually call that doctor who took the blood report or wrote the script for that patient that you're seeing, and communicate with them. And it's not this cold call because you're quote unquote sharing the same patient. So it's not this random call. Say, hello, my name is Dr. Forster. We both have this patient that we're seeing. I noticed this and this on the blood report. And because of that, we think, the best supplements will be these two. What's your thoughts? What do you see? And they get very into it and very excited because many times they feel like they're on their own island doing these things. And to be feeling like they can communicate with another doctor and pick someone else's brain, they actually really embrace it, at least from my experience thus far with it. And because of that, when they run into another thing where they think a certain dietary or supplementation or whatever type of healthcare that is needed, they might come into mind for another thing if they have another high or deficient level on a lab report or a urine or saliva or whatever it may be.
Great. That's really good. And they're receptive to that.
Oh, absolutely. Absolutely. It's one of those things where you it's not, the thing is, when it comes to being a doctor, it's not sales, it's providing a service. So if you're approaching it like you're doing sales, it might not come off the right way, because it's not a product. We're trying to provide a service to another human being. I mean, there's no really greater gift that we can provide to this world than giving our time to provide a service, right?
Absolutely.
So as long as you come across that you're here to provide a service for this ailment that this patient's living with, that you don't think has to live with it as much anymore, people gravitate towards that, because we're humans at the end of the day. You know, we like to say, you know, I'm a doctor of chiropractic when someone asks me what I do, but at the end of the day, I would like to think I'm, you know, Cal first, then maybe Dr. Forster second, and then maybe chiropractor third. So as long as you make it about being a human being first, and that you're providing a service second, then the whole rest of it usually, you know, goes well. And that's where, you know, getting a master's in nutrition and a certification, a doctorate, you know, holds weight in this society, to show that you're official and you're not just some person, you know, walking around the street making calls. But that's more of the last aspect of it, just to show your credibility more than anything else.
Right. I love it when when they hear you're a chiropractor and then they realize you know what you're talking about and how well trained you are.
Mm.
I love that look in their face of like, oh, I can actually talk to this person, you know?
Yeah, it's actually one of the things, you know, I love our profession.
Me too.
However, with that being said, there's something that I think is a real shame in our profession. So, if you don't mind me bringing it up, is that at the end of the day, it's, the license is DC, Doctorate of Chiropractic, and I think chiropractors decided to cut out the concept of the doctorate part and just go straight to I'm a chiropractor. And I think that's a shame, because at the end of the day, you're a doctor. And when you're a doctor, you're someone's primary care physician to an extent. And they should view you that way. And you should be able to delegate or refer them to where they need to be. And I would like it to become a world where DCs can be that primary conservative provider, instead of like, I'm just going to come here for my low back and I'll go to some other specialist for this and that. Or more like, I want to come to this person to figure out what's going on, what can they help with, and where should they refer me to, and be that portal of entry type of doctor. And to me, that's what I feel like was happening a long time ago with my grandfather and my father. I think it's moving away from that. I don't know if it's more about trying to fit in with physical therapists. I don't know where it lands, but you know, I see DC in a similar landmark to a DO and an MD. We're all doctors at the end of the day. Even though we practice a little differently, we're all doctors, and I would like to look at an I and a respect level, rather than feeling belittled and feel like all I can do is, when a patient comes in, regardless of what they're coming in for, I'm going to just adjust their neck and spine and let them neck and back and let them go on their way.
Right. Absolutely. Well, you know, as you continue to practice, I think you'll be pleasantly surprised. I mean, I've been doing this for 25 years, and you know, I said the same thing, you know, when I first got out, and I think you'd be pleasantly surprised at how many people will come and they're going to talk to you before they talk to anybody, because of a lot of the stuff you just said um, about being a human being first, and understanding the value of what you're doing with these people, and how, you know, delivering a healthcare service is one of the most precious ways you can spend your time. You know, when they see that level of commitment in you, believe me, that's something that's almost non-existent anywhere. And the fact that you know that coming out of school, that's fantastic. You'll be pleasantly surprised as time goes by.
That's wonderful to hear.
Yeah, so it's wonderful. As I'm sure you're starting to see that even right now, just being out there since November.
Absolutely.